Our trainer's telephone update the next morning was detailed, but necessarily non-committal. Thanks to the expertise and awareness of vet Professor Chris Proudman, Dream had been referred for surgery and an amazing procedure had been undertaken within 4 hours of his injury. Bearing in mind it was a Saturday on one of Liverpool's biggest sporting days of the year, you have to say it was a miracle that at 7:30 in the evening, Dr. Peter Milner and his team made themselves available and effectively saved Dream's life. 2 days after conducting the operation, Dr. Milner sent a detailed report to Professor Proudman, who forwarded a copy to Sandhill. When a copy of the report arrived in my postbox, I read it twice and I have to concede its content moved me to tears. The gist of it was factually medical, but the underlying tone told me that even in the most frightening of circumstances and in completely alien surroundings, Dream's brilliant disposition had touched Dr. Milner and his team. The report ended with a moving and painful synopsis. The horse recovered well for surgery, and although initially was uncomfortable, has improved within 48 hours following surgery. The trainer has been informed of its injury, and assuming the contamination infection of the sheath is resolved, with this degree of tenderness damage, it is unlikely that this horse will return to racing in the future. In other words, if the infection in the wound could be cured, then Dream would live, but he would never race again. When I reread the report, it was astonishing he had survived at all, and that's what got to me most. Dream had cut through the tendon sheath in the back of his front foreleg and split the tendon wide. A surgical scope revealed marked tendinous disruption with severe bruising and hemorrhage of the lateral portion. The surgery that followed was both complicated and sophisticated and was made even more difficult by the precarious condition of the tendon and the presence of infection. When it was all over, Dream was placed in a distal limb cast with his injured foot permitted minimal flexion, which basically meant his leg was harnessed off the ground. It was clear from Philip's relaying of the journey to the hospital and the manner in which Dream behaved throughout his ordeal that he had been the classic perfect patient, which had probably saved his life. It was as if he knew how bad the situation was, and he recognised that people he had never seen before were there trying to help him. I may be prone to exaggeration, but anyone who really knows Dream will know this is true. He just has the most amazing personality and an unquestionable perception of all things human. After all he had done for my battered morale over the past 5 years, I welcomed the opportunity of being able to do something for him. When I told Jan, she already knew and promptly declared he would race again, but quickly added that it didn't matter if he couldn't. He would always have a home. 3 weeks after the operation, Dr. Milner's associate vet, Guy Hinnigan, wrote to Sandhill's own vet, Phil Brown, with the good news that the infection had cleared. Dream's life was no longer in danger. But Guy was obliged to restate his colleague's opinion that due to the severity of their injury, it was unlikely that Dream would ever return to racing. To Joanne, the word unlikely was closer in meaning to might than it was to never, and that's where she stood. Later that evening, after I'd spoken to Jan, I went home and put our options to the syndicate, and for once, in all of our previous squabbles about what was best for him, we were 100% agreed. I later found out that stem cell treatment in horses had previously been used, and with a measure of success. What hadn't been tried before was treating an injury of the scale Dream had suffered, which included a complication of congealment and the high risk of infection. We had already paid a little over £5,000 to the Philip Leverhulme Equine Hospital in Liverpool, which everyone agreed was a small price to pay to save his life. And now we were ready to potentially wipe out our horse's retirement fund in an attempt to give him a better chance and a better quality of life. At that point in time, I wasn't allowing the prospect of him ever racing again to enter my thoughts. But needless to say, Jan was sure he would. In fact, she knew he would. More to follow. Happy Easter.